Hello and welcome back to Ask Miss Jai Live. Today we're going to be talking about collecting and documenting sexual orientation and gender identity in electric health records. And we're really going to be talking and going in depth around the uh, why we are collecting SOGI, why we're asking about it, how we can ask about it, and how we document it, and what if we can do if we can no longer ask about SOGI in healthcare environments. So stay tuned, and we will share a little bit on each of those topics. Hello and welcome back. My name is Miss Jai. I use she, her, and he, him pronouns. I am the host and the founder of Ask Miss Jai Live. I am here today to talk about collecting sexual orientation and gender identity, also called SOGI, and documenting that in electronic health records for health providers. Not everyone who uses an electronic health record is a clinician or a prescriber or a healthcare provider. You might also use an electronic health record in your public health roles or in case management. So we're going to kind of talk about some general ways that we can collect and document this information and why you want to be collecting and documenting this information. If you have never checked out Ask Miss Jai Live before, I am a public health expert. That is my background is in public health, working for 6 years in an LGBTQ youth drop-in center as a sexual health educator, HIV prevention specialist, substance use prevention specialist, and suicide prevention specialist. And then I also thereafter moved over to a teaching hospital where I worked running a case management program for 5 years for folks who are living with HIV for predominantly for adults. So throughout all of that time, I was working very extensively with LGBTQ people, and as one of the few, or if only, trans person on staff. Oftentimes I was working with trans and non-binary young people and then adults. So that's where I'm coming to you all from that perspective and some of the information that I'm going to be sharing today. If you have questions, go ahead and put them in the comments. If you're catching this live, go ahead and put a hashtag live in the comments or in the chat below. If you are catching this on the replay, go ahead and put a hashtag replay. Let me know what additional questions you have or what this is bringing up for you in terms of your role and how you're working in electronic health records. Also, please feel free to, if you're on YouTube, to like and subscribe to our YouTube channel for Ask Miss Jai Live, and share this with a colleague if it is helpful for them to understand how to better collect SOGI data and also how we can use that information to improve the health and well-being of our communities and our patients. So first and foremost, we're going to talk about why are we asking about sexual orientation and gender identity? We're asking about sexual orientation and gender identity in part, depending on the environment you're working in, it might be a recommendation or a requirement. So for example, the Institute of Medicine, the Joint Commission, the National Institutes of Health have all recommended asking sexual orientation and gender identity of the patients that you're serving if you're working in a healthcare environment. If you are working in an environment that receives reimbursements from Medicare or Medicaid, it has become a requirement from centers of Medicare and Medicaid to include these questions for the patients that you're serving, though including those questions means that they are still optional to respond to, just like other demographic information questions are oftentimes optional as well. So that's kind of the why is it required? Why is it recommended? Part of the reason it became recommended or required through these organizations and through these federal agencies is because the research that was looking at what collecting SOGI information looked like for the patient's perspective often found that patients, the majority of patients, were comfortable disclosing sexual orientation or gender identity or understood how it was linked to their individual care, and that most of the hesitancy or resistance was on the side of the providers, feeling uncomfortable with asking about sexual orientation or gender identity, or that it was crossing a boundary or crossing a line to ask about this information. The other reason that this became a recommendation or a requirement is because we know that when we start looking at the populations that we are serving and we disaggregate data, meaning that we start looking at subpopulations within that data, that we see that the ways that health services are distributed, the ways that linkage to care is experienced, the ways that return to care looks, are not the same across the patient population. So what we might expect is that we are providing everyone the same kind of care, the same level of care, the same quality of care, so everyone is experiencing the same level of health. But when we start looking at populations within our patient population, we actually see that it's actually not the same across the board. It's not, the services are not equally distributed, or accessibility to those services is not equal, or the experiences within those services is not equal. And so this gets us in a bit of like equity territory when we start thinking about how we can better serve the communities that we are seeing and the patients that we are seeing, and how we might need to tailor services, which gets us into this idea of high quality service. So when we are asking about sexual orientation and gender identity, we're able to better understand what the experiences of our patients and of our communities or clients are in the services that they are receiving from us, which helps us to then ensure that we are continuing to provide high quality services for all of the folks that we are serving. So let me give an example. If I am working in an HIV testing program and I'm providing the same testing out in the community as well as in a like a brick and mortar space to everyone, and the ways that I am talking to folks about HIV is the exact same. The ways that I am providing services to folks if they test reactive to get follow-up testing is the same. The ways that I'm counseling folks on risk reduction is the same. Then I might think everyone is getting the same dosage, everyone is getting the same service, so everyone's experience with this is the same. But then if I start looking at what's going on within that same patient or client population, when I start looking at sexual orientation, then I might find that I'm not serving a ton of heterosexual people. Maybe I'm serving certain communities within the LGBTQ community. And that might match with what we know around community level data for who is most highly impacted, or where there's like a disproportional experience of HIV, or it might not match as well. So I might find that I'm not serving a lot of heterosexual people in the data, but I'm serving a lot of folks who identify as gay men. And so then I have to look at what is happening in my community. Where are we seeing increased rates of HIV? Is this the population that we want to be prioritizing for these services? And if not, then I need to shift it. Similarly, I might look at the gender identity of the folks that I'm serving in this HIV program. And I might say, well, I'm serving 95% cisgender people, but I know that in our service area that there have been new clusters of HIV that have been identified in trans and non-binary communities, or I might know that there are no services available for trans and non-binary folks as it relates to sexual health within my community and my service area. So we're actually not reaching the communities that we need in this example. So asking about sexual orientation and gender identity helps us to better understand which communities we are serving, which patients we are serving, and the nuanced needs of those communities, or those people that we are serving, that we're providing care to. This then helps us as healthcare or public health providers identify disparities within our network. So oftentimes what I'm asked, and I think that this is a great question, is like, where's the data? Where's the research? What is this? We're seeing information about national levels for X, Y, or Z community, but what does it look like locally? So if I'm in rural Arizona and I'm looking at data across a number of research studies for sexual orientation and gender identity, but they are all based in urban hubs across the United States, then that might not be generalizable to what's going on in my rural city, in my rural county, or if I'm in a frontier area. But if I start, or if the organization starts to collect sexual orientation and gender identity information, then we can better understand what does this actually look like for our community, and how does that compare, or how is that different from what we're seeing nationally, or what we're seeing in these larger research studies. So it helps us to better understand any disparities that exist within our network and the people that we are serving. So then the second question that we're going to talk through is, how do we ask about sexual orientation and gender identity? So this is where I feel, and in the trainings that I've done with healthcare providers and the trainings I've done with public health professionals, which is where my focus is, right? I want to help healthcare and public health professionals better serve gender expansive communities by helping to address your questions and your concerns so you're able to go out and do your job effectively and better serve gender expansive people, trans and non-binary people. So one of the big questions that does come up is, how do we ask about sexual orientation and gender identity? And the first thing that I think of is, when are we asking about it? Because I think that there are times in our clinical flow, in our intervention flow, in our uh, public health program, where it would be appropriate for us to ask about sexual orientation and gender identity. And then there are also times in that flow where it's not appropriate to ask. So for example, let me do a clinical example. If I have someone who's coming into the clinic and I'm collecting demographic information, that demographic information might be collected ahead of time. So it might be before the patient comes to the clinic. They're filling out sort of like a pre-screener for an initial visit. So it might include demographic information around race and ethnicity. It might include demographic information about household size. It might include around income level. It might include information around frequency of cooking your own meals. So there's lots of information, like socioeconomic information, that might be collected during that same demographic form. During that space, we can also ask about the person's sexual orientation and gender identity. So that might be an appropriate place to ask about it as it's rolled in around demographic information. At the front desk or during registration, it might not be appropriate for me to ask about someone's sexual orientation, because or gender identity, because that's not going to impact the ways that we serve the person in that front desk or in getting them registered. But what might be appropriate for me to ask is if there's a name that they would like to go by while they're in the clinic that might be different from their legal name or the name that's on their insurance information. And it might be appropriate for me to ask what gender pronouns the person uses or how they would like to be referred to in the clinic. These are pieces that are connected to a person's gender identity, but we can't assume someone's gender identity or sexual orientation based off of the name that they go by or the pronouns that they use. There are also lots of cisgender people who go by a name that is different from their legal name or the name they go by, or that they have on their legal documentation, like their insurance card. And so giving folks the opportunity to tell you the name that they would like to use in the clinic can be appropriate and helpful for all staff, but especially at the registration or the front desk staff, the front desk space, because then we're making sure that we're not using a name or calling out a name or calling someone by a name or by pronouns that they don't go by. When they are entering into our clinical services, and the same goes for public health as well, right? So if we can, a lot of this is transferable to the public health environment, just depending on what public health services you're providing. Then, when we are talking about nuancing care, it's appropriate for us to ask potentially about sexual orientation, to ask about gender identity, because these are factors that can influence the way that someone navigates the world. They can influence the ways that someone navigates access to services. It could influence the way that we conduct an assessment, or the ways that we provide a service, or what we think about, again, from a clinical perspective, what we might think about symptoms are presenting as well. So it's a way for us to tailor and nuance the care if we understand someone's gender identity, because a portion of that is also understanding someone's sex assigned at birth. You may look at someone and perceive them as incredibly masculine. You might perceive them then as male because you connect masculinity with male. But by having these conversations around gender identity, sex at birth, sexual orientation, you actually come to learn that this person is transmasculine. And so the body parts or the organs that they have are not what you would typically uh, consider or connect with male sex. And so we want to make sure that we are conducting an appropriate assessment when someone is presenting with symptoms and that we are not making assumptions about what organs or body parts a person has. So the questions you can ask someone, again, across clinical flow. If you're asking about gender identity or sexual orientation, Fenway Health has a great list of examples of how to ask or what questions to ask and what options to provide. We also know that these are some generalized responses across the United States, and that there might be language that the community that you serve specifically uses that does not align with this language. So it can be helpful to ask the folks that you are serving what language or what terminology is used most frequently. For example, some parts of the country might use non binary as a generalizable term for folks whose gender identity is outside of the binary of man or woman. And in other parts of the country, they might use gender nonconforming. So it's helpful for us to get some localized information. But generally, the questions we might ask are, how would you describe your sexual orientation? Or how would you describe how you are emotionally, physically, psychologically attracted to? Um, how do you describe your gender identity? What is your sex assigned at birth? So the two-step gender identity and sex assigned at birth question can be helpful for for my data-centric folks for identifying trans and non-binary folks who identify as man or woman but have a trans lived experience. Fenway Health also has a question that they include on their new patient paperwork that I think is great, which is, do you consider yourself to be transgender, with a short description of what it means to be transgender, meaning that your gender identity does not align with the sex that was assigned to you at birth or on your original birth certificate. So these are some ways that we can ask the questions in documentation. At the front desk in registration, you can ask, what name would you like the clinic to use for you while you are here? Do you want to use your legal first name? Do you have another name that you go by? What name would you like us to use for our staff to use with you while you're here? And what pronouns do you use? A way that this has been helpful for me to explain pronouns, especially to folks who might not be as familiar with it, or sometimes even the word pronoun or gender pronoun has been politicized, and so it can trigger something in folks as well. And so the way that I express it, I say, hi, my name is Miss Jai. I use she, her, and he, him pronouns. How do you pronounce your name, and what pronouns do you use? And so that can be a way to sort of express to someone or share with someone what we're talking about with pronouns as well. We can also say, we try and be as respectful as possible to the folks who are coming into these services. And so we ask all of our patients or all of our clients what name they would like to use in these services and what pronouns they use. And then it gives folks the opportunity to disclose the pronouns and name that they use. We also might have folks who are like, I don't want to talk about pronouns. I don't want to talk about any of that. And so we have to focus on why the person is here by refocusing on, okay, we're going to just refer to you by the name that you have on file in your documentation, or the name that you've told us that you would like to go by while in these services. So we want to make sure that folks know that this is something that they can share with us, but that they are not, this isn't the time for us to go launch into like a gender identity 101 or a trans 101. We're focusing on what it is that the service that they are trying to receive. And then how we can explain about sexual orientation and gender identity. So sexual orientation, this is how the identity that someone has based on the ways that they are attracted to other folks psychologically, sexually, emotionally. All of those might fall under a sexual orientation. Some examples are heterosexual or straight, someone who's attracted to folks of other genders, gay, lesbian, folks who are attracted to folks of the same gender or similar genders, bisexual, pansexual, etc. For gender identity, we can say this is someone's internal thoughts, beliefs, and values, and how they relate to their own gender and how they feel about their own gender as it relates to being a man or a woman or non-binary. So there's ways that we can explain sexual orientation and gender identity, but again, this is not the space for us to do like the 101 sexual orientation, gender identity. I think keeping it brief can be helpful so we can move through this, understand that this is an aspect of a person's identity and what they're bringing into the room with them or into the service with them, but it's not the sole focus for a lot of folks. What we can also explain when we're talking about how we collect SOGI and why we're collecting it is we can explain how this helps us to provide tailored, customized services to their needs, and that these questions are optional. So if we understand how they build relationships, how they conceptualize their own gender, how they navigate the world, then we can provide more tailored, nuanced services and recommendations that are going to better serve them in taking care of their health and well-being in our services and in the future as well. So if we know, for example, that someone identifies as trans, then we might recommend different, like link them to different services or different resources that are more trans affirming. Versus if we know that someone identifies as cisgender, then we're going to be thinking about how can we link them or connect them to services that are built to serve them as cisgender people. So this is a way that we can provide a tailored, customized service to meet their needs. And I think one of the biggest challenges that folks have with healthcare and with public health services from the patient perspective is feeling like another cog in the wheel, feeling like another number, another metric to be met, another well, we served one more person. And so I think when we can help refocus this on, we're trying to create a space where you can be treated as an individual and you can be treated uh, with services that are specifically nuanced for you, then it actually helps folks um, to feel that they're being cared after, and and also show folks that we care about treating them as individuals and not just as another patient that we are serving. So now the moment that you've all been waiting for, 20 minutes in, how do we document SOGI or sexual orientation and gender identity in electronic health records or EHRs? First and foremost, most electronic health records already have SOGI demographic options available, whether they are activated or not activated in your specific version of the electronic health record. So a lot of the big players are things like Epic, eClinicalWorks, Cerner, or PowerChart. So all of those have the functionality to be able to collect SOGI information, just like they have the functionality to collect demographic information or income information for the patients that are being served or the clients who are being served. What might not be present is you might not have access to it in the certain version that you have, or it hasn't been toggled on. So when we're thinking about collecting SOGI, the first thing I oftentimes look at is it able to be collected in the electronic health records based off of the version that you have access to? And if it isn't, then one of the first questions we can ask is to the representative for uh, that electronic health record service and ask them if it's just something that needs to be toggled on. Are we able to toggle on sexual orientation and gender identity? Is that level of demographic information at a different tier? Would it cost anything, or is it just literally now it's available for us to start collecting? So if it is available, you can document it there and check it before being in front of the patient or client. So, for example, if you're able to collect sexual orientation and gender identity, and that includes things like pronouns, then you can check those before you're in front of the patient to make sure that you are not unintentionally misgendering someone, that you're using the correct pronouns for the patient or client. The second thing is you want to think about integrating it into the clinical flow. So that's part of that how we document, right? Is also where we then end up documenting it. So if we know that we're going to be asking about sexual orientation and gender identity between the provider and the patient, or between the fun person who's providing the direct service and the client, then it might be in that clinical note is where we are collecting that information if it's not available in other places in the EHR. If we know that we can collect someone's name and the gender pronouns that they use at registration, then it might be verifying that the registration software allows us to collect name and pronouns and that pipes into the actual chart itself. So there's some ways that we can start to collect this and ensure that that information is getting to where it needs to go in the appropriate step of the clinical flow. If you're unable to collect it in a demographic section, If you're unable to collect it in a formalized SOGI section in your electronic health records, then you can also collect that information in your clinic or your case notes. Um, because in your clinical or your case notes, you can make sure that you're including the sexual orientation and gender identity of the person, or at a minimum, the name that they go by and the pronouns that they use. I want us to be really intentional about how this information is collected and how it's utilized. Okay, so we'll see if this is still working. So we want to make sure that we are consistent in asking all of our patients or clients about their sexual orientation and gender identity after we've integrated it into the clinical flow so that we're not singling out just folks who identify as LGBTQ. And like I was mentioning, that we can then include in clinic or case notes and get in a habit of checking these ahead of time before being in front of the patient. We do want to make sure that what we are using and how we are using it is going to improve the health outcomes of the folks that we are serving and our understanding of the any health disparities that our communities are seeing. And then the final thing I'm going to talk about is, what if we can no longer ask about SOGI? So even if you're not able, even if something shifts and you're being told you're not able to directly ask about sexual orientation and gender identity, there's a couple of things that I want to mention. The first is that part of being an affirming and inclusive provider is the environment that you create for your patients to be able to share their experiences. So we might not be able to directly, or you might find yourself restricted from being able to ask specifically about sexual orientation or gender identity, but you can include that you are an affirming and inclusive provider by making sure that when folks are asking about things like sexual health information, when they're asking about exploring or connecting to resources, that you're giving them information to make an informed decision. So it could be something like, I might not be able to ask about gender identity, but I can say, this is an organization that is available to help folks, cisgender women, if that is a helpful resource for you. And someone might say, I am a cisgender woman. That is a helpful resource for me. And other folks might say, I'm not a cisgender woman. That is not a helpful resource for me. So this is a way that we can make sure that we are still informing folks that we are affirming and inclusive, and we're thinking about how gender identity impacts the ways that they navigate and get care. And then, even if you're not allowed to ask about sexual orientation and gender identity, patients can disclose identity to you, and you can still learn about and tailor how you treat patients and their needs, and clients and their needs. So, if you're thinking to yourself, I would like to learn more about the nuances of health experiences for LGBTQ folks, there's a variety of resources available. If you're interested in specifically trans and non-binary health experiences, we have just launched a foundations course on foundations of transgender and non-binary patient care, which helps go into depth around the social determinants of health for trans and non-binary people, and how to talk about health specifically with trans and non-binary people. So I know that we had a break in the middle of this. I'm grateful that we had a chance to get together and have this conversation. If you have additional questions about sexual orientation and gender identity, please feel free to put them in the chat or in the comments. I'd love to hear about those questions and help find some answers for you as well. I think that there's a lot that may be upcoming that we don't really know about, and that it's going to take a lot for us to sort of like parse out what makes the most sense. So feel free to leave those questions, those comments in the chat. And as always, I want to thank you for investing in the health and well-being of trans and non-binary communities, and more broadly the LGBTQ community. And really, when we talk about SOGI, I think we're investing in the health and well-being of all of our communities. So I want to thank you for that as well. Until next time, I hope that you take care of yourself, and I look forward to our next Ask Miss Jai Live.